Why do childhood TB signs differ after BCG vaccine? Imagine a child who has received the BCG vaccine, which is designed to protect against the most severe forms of tuberculosis. This vaccine is a weakened version of a bacteria related to tuberculosis, and it helps the immune system recognize and fight the bacteria if exposed later. But even though it doesn't completely stop infection, it changes how the disease shows up in children. Because the vaccine boosts the immune response, children who have been vaccinated are less likely to develop serious, widespread forms of TB like TB meningitis or miliary TB, which can spread throughout the body. Instead, if they do get sick, their symptoms tend to be milder or more localized, often affecting just the lungs or nearby areas. This means they might have a cough or mild fever but not the severe signs seen in unvaccinated children. The BCG vaccine also influences how the immune system reacts to TB bacteria, which can make diagnosis trickier. For example, after vaccination, children often develop a small bump or scar at the injection site, and sometimes their lymph nodes swell nearby. This immune response can also affect tests used to detect TB, like the tuberculin skin test, making it harder to tell if a child has an active infection or just a reaction to the vaccine. Since the vaccine doesn't fully prevent infection, some vaccinated children still get TB. But because their immune system responds differently, the symptoms they show may be less typical or less severe. For example, they might not have the classic signs like persistent cough, weight loss, or night sweats that are common in unvaccinated children with TB. Instead, their signs might be subtle or delayed, which can sometimes make diagnosis more challenging. The age when a child gets vaccinated, their overall health, and how much they are exposed to TB also play roles in how the disease appears. In rare cases, especially in children with weakened immune systems, the vaccine itself can cause side effects that mimic TB, such as swollen lymph nodes or even a localized infection at the injection site. In summary, the BCG vaccine changes how TB shows up in children by reducing the severity and altering the typical signs. This means vaccinated children often have milder or different symptoms compared to unvaccinated children. Recognizing these differences helps healthcare providers diagnose and treat TB more effectively. If you suspect TB or have concerns about symptoms, it is always best to consult a healthcare professional for proper testing and guidance.